with the physician's offices. We don't have a core, our products are geared towards the medical office, to the private physician, not so much to the hospital. What we call outpatient care, not places where there's beds and overnight stays and things like that. And those are the groups. Right now, I think the institutional groups have really embraced BPO as an opportunity, but the small doctor on the corner hasn't quite grasped what outsourcing this process can mean to them. And so we see that as a great opportunity.
I would like to add to that. The total transaction processing with respect to this revenue cycle management is close to $380 billion industry. Out of which only 2% has been outsourced to India till date. Now, if you are trying to segment that and see which sector is actually outsourcing, it's basically the hospitals that do that. And out of which only 20% are outsourcing. So as Shalane mentioned, there's a huge scope out there for targeting individual practitioners and physician groups who would be more than happy to see their bottom line increase significantly, because these are the people who have dearth of medical coders and medical billers, and they do struggle. So that is the segment core which we are aligning to target.
In the US, I was told that it's not a federal subject. So the laws are different in different states. So are you serving all states of the US?
Yeah, our customers are in all 50 states.
How big is your operation in the US?
We have a staff of just over 80 people. That's sales, service, and development. We have that back-ended by development resources in Bangalore.
How many are
there? In Bangalore, we have approximately 4,000.
50 people in Bangalore who do the core development.
How big is your operation in the revenue?
We're a private company. We really don't disclose our top line revenues.
What is Quantum Metro that has been recognized as VisionaryRCM?
Yes, Quantum Metro was incorporated in the month of June, and for revenue cycle management, that's when we figured out that there are great synergies which could be created with Visionary Medical Systems. So, in order to align with the Visionary brand name, we thought it was very ideal for us to rename our company from Quantum Metro to VisionaryRCM Infotech. Those two aspects is what we're looking at outsourcing to tier 2 cities. But as Shalane mentioned, the core, for example, analysis part, and for example, collections from the insurance companies would be done in metro cities.
This Office and Probiller is a product?
Yes, those are our two practice management software products, which are the tools that doctors use to record the services that they've rendered and send the ensuing claims to the insurance company electronically.
What are the salary structures like?
I'm afraid I have a few people of my company sitting here, so I will not be able to disclose that.
No, I'm saying when you're targeting the tier 2 cities, what are the entry level?
Oh, entry level. We're targeting anywhere from 7,500 to 7,500.
On the demand and supply situation, the skills available at that point in time. So what is good enough today may not be good enough 6 months from now. As you know, the salary skills are going up very rapidly in the marketplace, and I'm sure our revenue inflow would also change accordingly. So it's really not subject for.
So you're basically targeting the undergraduates, or how is it like? Are you targeting?
Okay, with respect to medical coders, we definitely need graduates, for example, biochemistry and pathology and all those things, because for coding, some specialization is required. There's something called AAPC certified coders. So for that, you need to get an exam done, and for which a lot of specialization is required. But if you train coding, you definitely need somebody who has some knowledge about healthcare and bio background. Now, with respect to medical billing, I think any graduate should do. Of the attrition rate that's happening in the industry, and in order for us to ensure that it's a service-oriented industry, so we got to be ensuring that it's basically like a backup system. So we would be spending, I would say, at least 10% on the training. It's a redundant system.
This are the same people who are using our tools, and we have an install base of 10,000 users. The appeal that we have to those users is that, number one, our workforce is going to be trained exclusively on our product in the initial stages, whereas somebody else, if they were to go to a third party, might be working with 4 or 5 different software systems, may have to learn their system on the fly as they try to get initiated with this doctor's business. The other thing that happens is if there's an RCM company out there that's dedicated to a particular tool, they're going to have to do a data conversion process to port the data over to the new system. So what we offer to the doctor is that we have people who are skilled and experienced and trained on their product who can start, we can sign a contract today and start tomorrow. There's no transition period, there's no learning curve, there's none of those things. So we feel like we have the inside track to anybody who has our software. We also feel that as a software vendor who's out there constantly marketing and has an extensive infrastructure, like I mentioned, with the staff that we have in the U.S., that we have an opportunity to offer a bundled pricing model where for the cost of their collections, we're able to offer them the services plus software, which is something that most of our competitors are not able to do. So I think our status as a software vendor gives us the inside track on a lot of other companies in this space.
I'm not too sure with respect to positioning, but with respect to having an edge over others, that's the one point that I would like to highlight. It's a consolidated package that we're trying to offer to the visionary clients, where we're trying to bundle the software and the services. So it basically helps doctors significantly improve their bottom line because they're not looking for different people for software and services. It's all on the same roof. They don't have to spend on training. They don't have to spend on setting up. So, we're trying to basically come out of the business model where we're trying to make sure that if we could offer them an installment basis of payment, probably to ease out their burden of expenditure, would be a great idea for them to basically get persuaded.
The pricing for this service is you basically charge the customer a percentage of what you collect. So the opportunity that we have is rather than looking at a customer and telling him that in order to get our software, you have to dig into your pocket and pay us some money, we say that all you're really giving up is money that is a portion of the money that's already coming in. So they don't see it as a loss, they just see it, and generally the improvement that we're able to facilitate in their collections process is more than enough to cover the cost of a bundled software pricing.
So how do you see your user base going from?
We sell additional software systems.
When was JV came into being? Joint venture.
December 2006.
So late for you to announce it at 4 months?
The JV was thought about in December, but we were trying to contemplate because the Visionary Medical Systems was at the verge of closing an acquisition in US. So we were trying to make sure that the company that they were trying to acquire is also a lab software company. So we're trying to integrate everything together as a bundle thing and then frame out with a very good MOU and SLA.
We executed an MOU back in 2006, and one of the reasons that I'm here is to finalize the arrangement. So we've piloted the concept at this point. Between now and then, we've added a pilot customer, which was highly successful, and with that in our pocket, we're moving full speed ahead.
What is the JV called now?
It's called VisionaryRCM.
That's what.
In India now it's called VisionaryRCM Infotech India Private Limited, and the foreign now is called VisionaryRCM Inc.
It's a startup, all right. We're not doing something new that others have not done. There's nothing innovative or creative. We are not the only ones who are doing this business. We are not the first ones in India. There are others in the play, but we are different. We have a very good partner, and we've got a track record of success in the US market. and they have the relationship built over a period of time, which is very critical for our business. Today in business, marketing is nothing but relationships, and they have very large in terms of number of relationships that they build. That's going to be a deciding factor for success of our business. And so we will see as we go along. I'm sure we have more options to meet. And of course, the most important thing for any business, we have two young, highly energetic young men who will drive the business forward. Thank you.
Thank you so much for